we are able to deliver to the patients the highest level of care that the patients require. Even though we know we provide an excellent service, we are constantly making endeavors to improve, to make sure that we are keeping state of the art with the technology, and we are able to provide patients with all the facilities that should be provided and even more if required. Patient who is being recommended chemotherapy for the treatment of their cancer would be given the information by their consultant regarding why that chemotherapy is being recommended, the practicalities of that chemotherapy, the benefits, the side effects. They'll have the opportunity to sit with the chemotherapy nurse to see how the chemotherapy generally is given. So in most cases, chemotherapy is delivered intravenously, but if the patient requires other procedures to be done, then we would make that arrangement in preparation for them starting chemotherapy. There is information which is being given, not all at one time, but as much as the patient needs and requires and desires, and it is fed in regular intervals so that people can remember and also digest the information, and then they can ask questions as required. They would usually have a blood test done a few days prior to starting chemotherapy, and then when they come for the first chemotherapy, the nurse would sit with them and discuss it again with them. Generally, they also have an appointment a few days before chemotherapy with the chemotherapy nurse to go through all the practicalities. After they've had the first cycle, they would have an appointment with their consultant again, depending upon the schedule, to discuss how they cope so that any changes required in the supportive medications or dose of chemotherapy can be done for the second cycle. One aspect which is very important in chemotherapy is that patients feel supported all the time, and the center provides a 24-hour service. Patients are given a card with a phone number so that whether it be weekend or midnight, if they have any issues, they can contact the on-call nurse. The on-call nurse will triage the call, and they will also inform the consultant in charge of the patient so that relevant action can be taken.